Brian, would you like to lead us in the pledge of
Allegiance to the flag of the United States of America and to the republic for which it stands, one nation, under God, indivisible, with liberty and justice for all.
Good morning, everyone. Very good. Welcome to the Shawnee County Board of County Commissioners. It's Monday, June 8th, 2020. On my left is Commissioner Aaron Mays, who represents District 3, and on my right is Commissioner Kevin Cook, who represents District 2, and I'm Bill Rippon, and I represent District 1. If we could add something to the agenda, I guess we'd have to have a motion for that, or?
Yes.
Jim Kraus, Shawnee County Councilor, yes, you can make a motion to add an item to an agenda. It will need to be seconded and approved by the full body
Okay.
to add something that hasn't been publicly noticed. Thank you.
Okay. I would like to add the Rossville pool repairs to the agenda.
Second.
Mr. Chairman?
Yes.
I object to this item being added, and I'm going to vote no against it. Not that I don't believe that we shouldn't have a discussion of the Rossville pool, but there should be notice to the public of an expenditure, especially when we're talking about an expenditure of $50,000 or more. This is being added on with no notice to the public of a major expenditure. And also, there's a question as to the legality, which we've been bringing up for 8 months. For 8 months, we've been talking about the Rossville pool. And who's the responsibility of the contract? Contracts going back to 2007, 2008, 2009 with the maintenance. You yourself have gone out to the city of Rossville to talk about the pool. And so I think adding this we do need to have this discussion. We've already expended $20,000 for the leak of the Rossville pool, but having it with no notice is not transparent government. So that's going to be my objection.
Okay. We have a second on the motion. Motion's been made by Commissioner Rippon, seconded by Commissioner Mays. All in favor, say aye. Those opposed?
Nay.
Motion carries 2-0. I think in the interest of time today, I know a lot of you are here probably, could I just see a show of hands that are here to talk about the farmer's market? Okay. I'd like to move that kind of to the front of the line here so I don't want you to have to suffer through the rest of our meeting. And, but we could start out with Dusty Nichols, who's with our Emergency Management Department. He can just give his presentation, then we'll have some open. Do we need to have a motion to do that?
Would you please make a motion and add that as just an item for discussion?
Is it just a presentation, or is it a?
Item for discussion.
Okay. All right, I'd like to make a motion that we add an item of discussion to talk about farmer's market.
Second.
Motion's been made by Commissioner Rippon, seconded by Commissioner Cook. All in favor, say aye. Those opposed, motion carries 3-0.
Good morning, Commissioners. Dusty Nichols, Incident Command for COVID-19 Response, Health Department. There's been a lot of questions on the mask phase 3. This kind of ties into the farmer's market discussion, so I'm just going to take a few minutes. This should not take long and go through where we're at. Phase 3 mask wear. This is the requirement that's in phase 3 that was approved last week at the Board of Health and issued out last Friday and took effect midnight tonight. As it says, it's required for the tables below. This is pulled from the tables specifically about masks. Retail, third bullet down, is one in particular that applies to farmers market. Employees who have contact with customers should wear a mask at all times. going forward. This is the recommendations as of June 7th from the CDC, Office of Surgeon General, and World Health Organization. All recommend cloth mask wear to slow or stop the spread of COVID-19 in communities. So those are easily looked up. Mask wear restriction in phase 3, all 3 KDHE all recommend the wear of masks. Locally, we want to be able to balance opening and keep the economy open and going, open in all businesses as much as we can. In nearly all situations, mask wear, a single person could be asymptomatic, exposing hundreds, if not thousands of people is mandatory. That's why it's in our order. Employees who have contact with customers shall wear masks specifically. Our numbers are rising. Our case numbers are continuing to go up. So we need to keep that balance between continue to opening up and protecting citizens of Shawnee County. We can't be afraid of this. We just need to respect the threat and wear the masks, not be afraid of it. We know how to do that through mask wear. So speaking of the downtown Topeka's Farmers Market, first and foremost, we looked at the industry standards, specifically on the CDC. The red bullet there recommends cloth face coverings. There's other stuff in here. This industry standard, the Farmers Market Coalition, has best practices, sample plans, items that they can use as far as redesigning layout, all kinds of things on there. This is a good resource for Farmers Market to build plans with. Going back, Kansas Department of Ag specifically talks about organizers must, to the extent possible, without significant disruption to essential functions, which the farmers market is an essential function, to protect farmers and staff. And then it talks about specifically if they decide to open or not. Locally here, retail business, this does apply. I do want to mention as we go forward, when we're talking about the vendors being renting booths and such, we've had one point of contact with the farmers market, the management of. We don't know who all the vendors are. We haven't singled anybody out. This applies equally across the board. So when we've had these discussions with the farmers market, it has been with their management and or the management board, we're assuming, and that's who we've been going back and forth with. Mission of our incident command team, above all, is life safety, incident stabilization, and property conservation. So we want to protect and save lives if possible. Incident stabilization is stopping or mitigating the spread of COVID, and property conservation in this case refers to the economy, essential functions, keeping them open. We need to monitor the healthcare system in Shawnee County. That includes the health department and contact tracing. That's a key part of how we balance everything out, not just the hospitals. Prepare and maintain level of readiness to meet mass casualty or patient surge, and that's what we've been really successful doing up to this point. Create and coordinate teams, task force to ensure our leadership teams have some situational awareness moving forward, opening the county safely. I meet weekly with all kinds of groups, faith-based community, schools, baseball, softball leagues. So we're sharing information across the board, education, we're doing everything we can on a weekly basis with all those groups. And I work individually, me specifically, I work individually with groups, event coordinators to include weddings, funerals, business owners, managers, you name it. I work with them individually to make sure that they're in coordination with the restrictions and guides, that they can open up safely. We have not had a reason to shut a business down yet, and we haven't. And that goes with the farmers market. We did not shut the farmers market down on Saturday. I don't know how that rumor got out, but we did not shut it down Saturday. Again, we work to correct rumors and attempt to educate and communicate the phased plans. So we are working with them, all businesses for that matter. But the other thing that we do is investigate complaints, and we get a lot of them. Sometimes they are not factual. Again, that goes back to the rumors. And how we do that, we do a first contact when we get the complaint is received. Usually it comes directly to me or one of the team members, or it goes to the 4848 COVID hotline number. If that happens, usually the COVID hotline gets it, and then contact is made with that organization, first off to see if it's even valid. Sometimes it's not. Sometimes it's just misunderstandings or that the phase is misunderstood or whatever the case may be. The call taker will get the guidelines to the point of contact or managers. They have the most current information, fact-based. Call taker, the second time we get a complaint, which happens occasionally, they'll contact an organization to make sure there's not any confusion or if we can help them in any way build a plan to keep them in compliance and keep them open. And so far, that's usually where things stop on these complaints. Third contact, one of the command staff, which is usually me, Aaron Mahan, sometimes it's Linda or Craig, somebody from the command staff will make contact and call them, and then sometimes we go on site. I've only had to go on site twice to discuss it, and once it was more of an on-site visit to help them figure out a plan and flow, those kinds of things. Fifth contacts, orders from the health department are developed that will close the business. This is coordinated with law enforcement as well. If there's any questions about the legal side of this, Jim Krell's prepared to answer that. But we've gone through all of these with the farmers market. We've been on site numerous times, saw some of this stuff firsthand ourselves. We have people send us pictures. I will say on some of the pictures, they are just vendors not wearing masks behind the table by themselves. Those don't concern us too much. It's the ones where they're face-to-face with a customer not wearing masks, and that's where this last complaints come up. So we have been in contact with the downtown Topeka's Farmers Market even before they open. That March 31st is about the same time that Department of Ag guidance came out. It has not been shut down. We have not shut it down. It does fall under retail because the vendors are selling goods. The downtown Topeka is not unique and must comply with orders issued by the health officer and Board of Health. It's not unique. Sometimes the thought is that it's unique because it's outside, those kinds of things. It's still within 6 foot most of the time where the vendor's dealing with the public. So that's where the mask, again, comes in. Again, we had a single point of contact. The market manager took the role of point of contact, and so they are sharing the information, or should be sharing the information with all the vendors. And I'm not sure how that's going because we deal with the one person. So at this point, Dr. Pizzino asked the market to submit a plan. Again, they can use the industry guidance to develop that plan, and we won't have another issue as far as we're concerned. It's expected to not allow any individual vendor that is not in compliance. So if somebody just refuses to wear the mask and go against the guidance restrictions, then we expect the Topeka Farmers Market, and that, as it says in the industry standards, to take action. And we just need that plan no later than noon on Friday because they do intend to open on Saturday. The response team members will continue to do our jobs and investigate the complaints. And just a reminder, those restrictions are applied equally to all businesses, and this process applies to all that. So we want to keep everything open. I work with companies, businesses, events to make sure they're done safely. We need to keep moving forward, opening the county. And I know that makes some people nervous. But again, if we respect the threat and not fear it, wear the mask, protect each other, it's pretty simple to get business done and keep opening while protecting and preserving our preparedness levels with the hospital and ready to respond. That's all I have.
Dusty, I have a question. If they don't produce a plan, what's your action at that point?
Dr. Pizzino has the authority, Jim Krell can mention this, to issue an order to not let the farmers market open.
So it doesn't apply to individual people out there, it's a blanket.
And the reason for that, we don't know who those individual people are. And that's where it goes back to the industry standard to manage their farmers market. So our only option, without knowing who those individual vendors are, to just cover the whole farmers market. And I will say, the one thing we really don't want to do is disrupt the farmers market and have law enforcement go out and single out. That's not what we want. We want to keep the whole thing open.
I want to talk about masks for just a second, because that's what this comes down to, is masks. And, I think the verdict's out on the mask. The experts don't agree. They really don't. I may not be a medical expert, but I am informed on things. And, even the Secretary of Health, Dr. Lee Norman, developed the phase reopening for the governor. In Phase 2, masks were strongly recommended, but they weren't ordered. But they weren't required, they were just recommended. In Phase 3, I don't even see them mentioned at all. And it just says, continue personal hygiene. We continue to have that requirement, but the state secretary of health does not. Are our numbers so bad that this is required? Right now, using the KDHE's numbers, you have a 1.5 chance in Shawnee County of being infected, or has been infected by the virus. Our current death rate in Shawnee County residents is .003. That's not 3%, or that's .003 of 1%. Because we've added these restrictions beyond those of state health department, we've turned a lot of our citizens into tattling on other citizens. And I know a lot of people don't wear these masks right. They don't wear them correctly if they're wearing them at all. But I hate that kind of situation where we have one citizen tattling on another. I absolutely hate that. Even the experts, you mentioned the World Health Organization, they came out stating the use of masks by individuals was detrimental at one point. Now they've walked back to recommending the mask. These are experts, and they can't agree. CDC has changed claims on masks numerous times. Moisture retention used of cloth masks and have poor filtration and may result in the risk of infection. This was the CDC. What I find is mask wearing may further spread the virus. Studies of cloth masks that we see are very limited, and suspicions are high that improper use increases the amount of virus lying around. They should be kept clean at all times. One study showed that you're 23 times more likely to touch your face if you have a mask on. These masks create a false sense of security for a lot of people. My understanding is it's not to protect the mask wearer, it's to protect the people around you. I don't think most people know that. And when they are wearing a mask, they tend not to practice social distancing. One study showed that you're better off touching your cheek than touching a moisture-ridden mask. If it's warm and moist, you're better off just touching your bare skin. I go into restaurants and I see employees touching their mask. It looks like a warm, moist place to harbor germs. I tend to think of it as a petri dish attached to their face. I don't claim to be an expert, like I said, but I am informed. I'm perfectly fine with others feeling differently, but I like the freedom of choice. And I think restaurant owners or people at a farmer's market, they can make their own choice. We're adults. We can make our own risk assessments. And, if you don't like somebody not wearing a mask, don't buy from that person.
Mr. Chairman,
Yes?
just as a point of order, last Thursday, we adopted Phase 3. We had a
Yep.
healthy discussion on Phase 3 about this issue. The Board of County Commissioners took no action after that discussion. Masks were not or not a recommendation, but a requirement.
That's right.
And so we have charged, as a Board of County Commissioners, we have charged our recovery team with to follow that order. And so by you saying this is your personal belief as to masks. If that is a disrespect to our board, once he's been charged with that duty, you are now delivering a different message that he has to follow.
Commissioner Cook, this is not an order on my part. This is an educational one.
No, but this is but the farmer's market that we're here for, that everybody's here about. We are leading and letting the businesses monitor themselves. We only step in where the businesses are unable or unwilling. I'm sure that Dusty has a lot of other things that he would be able to do with his time. But we have a discussion on Thursday regarding the Board of Health. This is a Board of Health issue that should be taken up on Thursday. So,
I'm not asking for a vote right now. this is an educational moment. That's all it is.
Well,
I'm just
Why don't
presenting.
we just talk about the herd immunity that's not successful in other countries? Why don't we, I could talk
I
about
don't- we
MSNBC,
don't-
CNN, Fox News.
We don't know that
this, that,
we don't
and the
have the
other.
data on the herd immunity.
We don't know any, I mean, we rely on our experts.
Exactly. We don't know on the masks either. We don't know. The experts don't agree. That's
I
all I'm
highly
doing.
disrespectful of our incident command leader.
I would just add, I do tend to agree with some of what Commissioner Rippon's saying. There has been a lot of confusion on the mask from the beginning of this, which is why I specifically went out on Friday and pulled this, and they all agree. And specifically, the World Health Organization that advises that government should encourage the use of non-medical fabric masks, so forth. We're not requiring it for everybody. We do believe everybody should make that choice. We are requiring it for those high-risk events where people can, a retailer may see hundreds, maybe thousands of people, and if they are symptomatic, potentially affecting hundreds, maybe thousands of people. So that is the stance. We did listen to the experts. We are looking at the CDC, Surgeon General, who have all changed their minds. But this is the current mind change right now.
I want to say that I am not trying to disrespect our department. That's not what I'm doing. I'm just showing that there's,
But you are disrespectful. Once we put a plan into place, we as a commission has charged him to follow that. And so if we want to deliver a different plan, come Thursday, you can make a request to change the plan.
am I not allowed to just give my views today?
Well, your view, I mean, it would be akin to saying, we have lifeguards at pools. Why don't we just remove the lifeguards? We'll let people swim as they may. If they drown, that's on them because they were being dumb. We have some responsibilities, and in this case, we as a board, we had that again. It was not a united decision. We came to it and we talked about it.
We didn't vote on anything, though.
Maybe Commissioner Mays has some other views as to what happened.
Okay. Do you have any comments? He has no comments. Okay, I know some of you came here to talk, and I would like to hear you. Try to keep your comments brief, because there's a lot of you here, and we need to move on.
Good morning. My name is Janlyn Nesbitt Tucker, and I'm looking out over the sea of people that have gathered. We all stood up and we all took our mask off and said the Pledge of Allegiance. There are many of us that are not 6 feet apart. I fail to understand what the problem is here. You know, it's almost like there are two different mindsets, two different rules. You have your rules against the farmers market, but then you have the rules for the protesters that are not only destroying our city by some of their riotous actions, but, you know, are not wearing masks, and there is no repercussion for them. I just fail to understand. And you know, let me share a story, and then I'm going to let someone else come up here and reiterate whatever I say, because I'm sure we have the same message. My family and I were at a Mexican restaurant for the first time a couple of nights ago. And it was so nice to finally be out and to, visit an establishment that has been so impacted by this horrible situation. And I want to show you. We were sitting there, and my daughter says, "Mom, look." And the guy that was cooking was like this, wearing the mask as a beard. You know, what is the deal? I don't understand why there are two different, there's two different sets of rules. Wearing the mask as a beard, I just think that you really need to think about things. And then, Mr. Nichols, you just got through telling us that y'all would be shutting, first of all, there was not a rumor that you had closed down this past Saturday, the farmer's market. The rumor was that, and it's not a rumor because I saw text messages that came back and forth with you. The texting was that if the farmer's market merchants did not comply, they would be shut down next week. So let's get that clear. There was not a rumor that you closed the farmer's market down, okay? It's a next week kind of thing. Further, let me finish and then you can jump in. You know, you said in some of your PowerPoint, one of your PowerPoint slides.
I'm sorry to interrupt. We should be directing comments to the chair, and then if we...
Okay, well, then I'll do that.
Okay.
You should not be speaking to him back there. You should be, this is the who you.
Okay, so let's just, okay, y'all just heard everything, right? Okay, further, one of the slides talks specifically about dealing with individual businesses. Why are you punishing the entire farmer's market for the violation of one person or one business? Had you rather them faint because they suffer from heat exhaustion because they're wearing this thing? You know, would you, rather, I mean, you can just do this better, and you're not. And for you to be so fussy about a discussion that is so important to our community is outrageous, Mr. Cook. Outrageous.
Just to clarify, as far as there's a couple things, I gotta go back. As far as protesters, we recommend for the general public, that includes protests. We don't regulate protests, we don't single them out. That's, mass gathering rules and all those things do apply. We require masks for vendors who are dealing directly with the public. When they're not dealing directly with the public, it is hot. Take the mask off, get a breather, drink some water, please. We don't want any of that to happen. While you're dealing directly with the public, please wear the mask. That's the recommendation.
Is there any limit to the number of people who do a mass gathering if they're not dealing with the public?
Most of the public dealings are one-on-one, and that's what we're discussing specifically.
But I mean, if you have a mass gathering,
Mass gatherings are at 45 as of today.
what about like a protest? What do you do in that case?
We don't regulate protests. It's a mass gathering. In here, we're 45 people.
All right.
So
Okay.
that's the
All right.
balance we're trying to strike. There was one other comment that I was going to try to address that she had mentioned, and I can't remember what it is.
The rumor.
Oh, the rumor. I was taking time off Saturday, and that's the first message I got that, the question I got from media was, did you shut down the farmer's market? We did not on Saturday. We didn't shut it down Saturday. We haven't shut it down for next Saturday. If they follow the guidance that's put out by their industry standards, meeting the requirements that the Board of Health and the Dr. Pizzino, the health officer, put forward, we won't shut it down this week. We just need a plan.
Who had the communications with the farmer's market? Was that you communicating?
I
with them?
usually communicate directly with the farmer's market, the one point of contact, Mary. And I know Dr. Pizzino talks to her as well.
There
I
must-
talked to her on the phone Saturday morning, and I know Dr. Pizzino was on site and talked to her face to face. And I think I wasn't there, so I don't know that conversation, but I think that's where that started.
And I'll, just for whatever it's worth, is I would also say, there certainly was a rumor that we closed the farmer's market on Saturday, because I received probably 20 different
55.
emails that said, why did you shut down the farmer's market? I can't believe you had shut down the farmer's market. We did not shut down the farmer's market. That was certainly a rumor. And as I understand it, it was actually reported on a media Facebook page that
yeah.
we closed it, and then it was retracted a little bit later in the day.
Yeah, I was tagged on those posts and responded with what we were trying to do. We try to keep businesses open. We're following the guidance that is set forth, and we're just trying to get everybody on the same page. And we were clearly not on the same page for a while on Saturday,
It was not.
Saturday evening.
I got 55 emails, which is a lot. a lot. I don't recall ever getting 55 emails on anything ever before. So we had a PR problem, a bad one this weekend, and hopefully we can avoid that in the future.
I totally agree, sir.
Okay.
My name is Mary Tyler, I'm market manager. I would like to tell you from my perspective, our perspective, what happened on Saturday. Friday evening at 5:15, 5:17 to be exact, I got an email from Dustin saying if we come there Saturday morning and not even, if we find even one vendor without a mask on, we will shut you down. That was in an email at 5:17 Friday afternoon. I tried to call Dustin, tried to reason with him. He did not answer his phone. I went around Saturday morning and I told each and every vendor, this is what I got last night and this is what we are being required to do. I told each and every vendor. I'm only one person. My board is here, not every single one of them because they can't make it. But the board, I forwarded that email to them. They all read the same thing I read. And Dustin called me Saturday morning. He said, Mary, I don't like what's being said. People are sending me complaints. I have pictures of your vendors not wearing masks. A lot of those pictures were taken before we were even open. So I don't know who's going around snitching and sending these things to Dustin. He's not there. I am there at 5:15 a.m. It is already hot. And we were told that unless you're in direct contact with the public, you do not have to wear a mask. Well, guess what? It changed Saturday. You have to wear it all the time. Yes, a farmer can unload without it on, but he has to put it on as soon as he's done unloading. He can take it off when he's loading back up. I have farmers, that come in there in big trailers with heavy stuff. When it's this hot and you're requiring them to wear a mask, I had people almost having heat strokes. If I asked for a show of hands, you would be shocked how many people wore these. We were said. So I asked Dr. P, what can you do to help us? Let's reason together. He said, tell them to wear a paper mask, not a cloth one. I wore one all day Saturday. According to my phone in my hip pocket, I walked 3.5 miles with this thing on. In that heat Saturday, I don't know how many of you were out, but it was hot. I was sweating. I had a headache. I was lightheaded. Dr. P came, when Dustin called me, he said, we are shutting you down. You will not get to open Saturday. That was a phone call, so it can be a he said, she said, but that is what he told me on the phone. And he said, I want you to know Dr. P is on his way down there, and he wants to see for himself this is really true. I booked myself around that market again and told every vendor, please, he's coming, and he's not happy. Sure enough, I walked around every single vendor. I have pictures, if you guys would like to see them. Every one of the vendors, including their workers, had masks on. Every single one. He comes and finds me, and he said, Mary, I'm not happy. I said, what did we do now? And so I went and got one of my board members because I don't like to be the only one that's saying, oh, well, Mary's out to lunch. I went and got one of my board members so they could hear the same thing I was hearing from Dr. P. And he said, I don't like what I'm seeing. You will not get to open Saturday. A letter is being drafted as we speak by Linda, I don't know what her last name is, and you will not get to open Saturday unless you send me a letter with guidelines and how you are going to enforce this. I said, sir, how do you recommend that I do that? You know what he said? It's not my problem. That is your problem. He said, if you cannot enforce it, get police in here and have them in handcuffs and take them out. That's what he said to me. We are a farmer's market. And I'm like, sir, it is hot. Can we at least pull them down? He said, no. My assistant is sitting over there in the information booth with a mask pulled down. I said, is this okay? There's nobody anywhere near around her. She's pale-skinned, her face was red, and I said, is that okay for her to do that? He said, no. I said, there's nobody even close by. He said, you have to be an example. No, you never pull that thing down. And if you need to eat or drink something, you need to step outside of your booth. Do not be in your booth at that time. Wear that from the time you get there until the time you leave, unless you're a farmer unloading heavy objects. And that's the truth. That is what happened Saturday. Questions for me? Yes, sir.
If the vendors were only to wear the mask when they're interacting with the public, would that solve the issues?
Well, I'll tell you, I have customers, I have vendors who are up in age, and some of them flat cannot wear them. They're going to have a heat stroke. Then they're going to come after me. I had a heat stroke, and I can't, I mean, some of the booths are very busy the whole entire time. When the heat index is 105, we can't, our body breathes to cool us down. We can't breathe with these things on. And now they're having to take them off because they're soaked from sweat or from whatever else. They're having to take them off and put them back on again. And I mean, I walk around and the vendors, their masks are dirty. They're not white anymore because they're constantly touching them. I'm asking, as a farmer's market, to our community, we have fresh produce, we have fresh goods. Can we not work together? And we are there for 5 hours on a Saturday morning. I'm there longer than that, but the majority of them are not. Can we not make an exception for the farmer's market? We are outside. We have put up do not touch signs. We have put up please respect social distancing signs. We have hand sanitizers at each and every booth. I go around all the time making sure this is happening. We have a hand washing station at the information booth so people can come wash their hands. I mean, in my opinion, we have bent over backwards to try to stay in compliance.
But just make sure that I'm clear, that your request is that no vendors are required to wear a mask during the operation of the farmer's market. And the farmer's market would be an exception from any other retailer, that the farmer's market would not be required to wear a mask.
That is correct. And I'll tell you, there are so many retailers out there not wearing masks. Why are we not enforcing them? I can name stores that people called me. I was at fill in the blank, and I don't want to throw those retailers under the bus, but they are out there. They are not being targeted. They are indoors. We are not. We are outside in the sun where this stuff doesn't even live.
But we didn't get to today. This wasn't the first step. Wasn't it a series of steps where Dusty and Dr. Pizzino have been meeting with you to talk to you about the farmer's market and what we might be able to do with masks? We didn't get to just a shutdown order yesterday.
We did. That is correct. He did send me an email and said, this is required. You guys have to, if you're in contact. Yesterday, Saturday, he came and said, no, you have to wear it all the time. I mean, we're just going from bad to worse.
Okay. So, but this was not something that just popped up. This has been a series of discussions and back and forth.
Exactly.
And now, that's my understanding, that we're working with all businesses. Where there's needing to be some clarification as that we're sitting down, and there's not, to this day, there's not been a single business in Shawnee County that's been shut down. We've not padlocked the doors on a single business in Shawnee County because they were refusing to wear a mask. So what we're trying to do, though, is to educate and to make sure that people understand what the best practice is and what the recommendation is from the Board of Health, that masks are required and when they're required. And that's why I'm asking, you're asking for an exception specifically for the farmer's market, that the farmer's market not be required to do it. But if you are a flower shop, if you are a photography studio, if you are a antique store, if you are a big box retailer, the rules apply to you, but not to me.
They're not being enforced with them.
Okay, and I think that's a secondary discussion. But you're first asking that there be a different set of rules for the farmer's market
That's
than for
correct.
any other place.
That's correct.
Okay.
Commissioner,
I just want to make sure I'm clear that that's what the request is. that Mary has asked for. She's asking for one set of rules for the farmer's market, different than every other retailer.
Well, one of the things that differ from the other retailers is they are outdoors and, 95-degree weather too, so that, to me, is a difference.
I mean, what am I supposed to do if somebody comes to me and says, I have a headache, I'm lightheaded, I'm getting ready to get sick, can I pull this thing off? What am I supposed to do?
And that maybe is a discussion for, if we can allow Dusty or Dr. Pizzino to address that.
I asked him that, and you know what he said? No. If they cannot be here and they cannot wear a mask full-time, they have to leave. I'm sorry, but I'm not seeing reason here. We are, like you said, we are human beings. We are adults. What happened to allowing us to make our own decision if we want to jeopardize ourselves and get the virus? Yes, the numbers are so low, it is just unbelievable. But we're blowing this thing clear out of proportion. Let's build each other up. And let's serve the community. Let's not cut each other down, because that's exactly what's happening.
Okay. But just for a point of information, as of yesterday, we were at almost 100 active cases in Shawnee County. That's a doubled of our numbers in 30 days. Our number has doubled in 30 days' time. We went from 40 to almost 100 in a 30-day period. By taking the action that we've taken, we're seeing such a low transmission rate. If we remove those protections, are we prepared for that number to double in the next 2 weeks? Are we prepared for that number to double in the next week? And as a community, that's the question. Are you prepared for that? We've seen, the rise in the numbers. And having spoken to, a good friend of mine that had the COVID virus, he talked about 6 days of not being able to even move from his bed. Now, luckily he was able to recover, but he also describes it as being something way worse than he's ever experienced before. So that's just anecdotal information. But I think that's the reason why the Board of Health has taken the action they take, is the Board of Health wants to be able to put in some restrictions, but not eliminate business. As of today, every business in Shawnee County is open.
How many people were hospitalized of that 100,
8. We've had 8 current hospitalizations, but as to the lifetime of the hospitalizations, that's a different number.
I'm just talking about from this 100.
Currently, we have 8
From
as
this
of
100.
yesterday. As of yesterday, there are 8 hospitalizations.
But we don't know how many of that new 100.
Of the new 100, I don't have that
That
information.
is of the
I'm using the
100.
dashboard.
Okay.
There's 100 active,
You know,
8 in the hospital.
when all this started, our main goal was to not overrun the hospitals, and we didn't want to overrun our supplies, and we never have done that.
So that says, what, 10%? If we use, there are 100 active cases and 8 are in the hospital, 10% are going to be hospitalized?
8%.
If you look at the age demographics, our age demographics are all age demographics that are affected. Again, all of this information is available on the dashboard, and it's put up on the county website.
Any other questions for me?
Thank you.
Good morning. My name is Sylvia Guerrero. My husband and I have a small business. We have a food truck, JLG Mexico. We enjoy serving our community at the farmers market. We are aware of the COVID-19 health crisis, and we take great steps in preparing our food appropriately according to state regulations. During this heat, it has been difficult to wear masks. First of all, I have asthma. It's really difficult to breathe in the heat, and it's not helping the situation at all. In addition to being somewhat claustrophobic, not being able to breathe with that mask on triggers an anxiety attack. I wear my mask as often as possible. I take short breaks when necessary. The farmers market is an essential resource for our community. Closing it would be a grave mistake. Thank you.
Thank you.
My name is Barry Benneman. I'm not associated with the farmers market. I was a pharmacist for 43 years, 28 years in retail. I've probably given around 1,500 vaccinations for flu. I've worked in hospital for 12 years. I've worked in sterile hoods that had laminar airflow flow hood filters that were filtering things down to the micron. To give you an idea, a millimeter is 1,000th of a meter. A micron is 1,000th of a millimeter. I don't know how accurate it is. One person said, if the COVID is a football, the size of the holes in your mask are about the size of a football field. So that gives you a relative thing. I would not have come out in public as much, except I was blessed to see a video by David Price. He's on YouTube. First time I saw it, it was over an hour, but the YouTube is, now they've cut it down to about 10 and a half minutes. He is a pulmonologist in New York City, primarily serving COVID patients. He went and he talked about, he said, I sound nervous, I'm not nervous for the first time. His main points, and I'll just go over 3 of them now. First, hand washing. You want to wash your hands as often. Initially, I'd washed my hands so much that the skin was coming off my hands. I backed off that a little bit. Face mask, he said the main use of face mask at that point in time was to make yourself aware of not touching your face. I'm holding my hands like this so I know where my hands are. So I don't automatically reach up, because it's just standard practice to reach up. If I hold my hands like this, so that and go ahead, and he said, cut down on your public circle of friends. I tend to be a hugger, looking around here with only a couple exceptions. I don't have any temptation to hug, so no offense. Okay. In terms of getting out, the governor of the state of New York was amazed to find out 67% of the hospitalized patients in New York were people that had never gotten out of their house. It's family contact. And what Dr. Price talked about is if I'm around one of you and you notice it's about 10 to 12 minutes and I say, I gotta go, he talked about 14 to 15 minutes in close contact. It's the best opportunity to transmit the disease. It's not just causal seconds like that. We had the farmers market. There were people that did have masks. There were people that didn't have masks. But the whole idea, if we look at, there's one country that did not shut down, Sweden. They took a hit. They realized that they did not protect their elderly the way they should have. But their numbers are below most other nations. There's a state that didn't shut down, North Dakota, and their numbers are below. You compare Florida to New York, comparable population. What's the number for New York? Over 15,000. Florida's under 2,000. New York had 5,000 nursing homes because the governor insisted positive COVID patients had to be sent back to the nursing home. So that's on him. He hasn't taken that. I've seen studies, and some of them are debunked, and the difficulty in finding out what's right is so difficult, because even the peer review studies, they have them up. Even the Annals of Internal Medicine, they had something up for a couple of months. They had to pull it back because there were errors in it. And so this is so new. There's has not been time yet to even verify what's going on. And to be honest, we're going to be discussing this for decades. Your grandchildren are going to be studying about this in school because we just don't know. So it's even now, there's experts on both sides on masks. I'm not wearing a mask because I know what a mask can do and I know what it can't do. If you're not wearing it right, you've totally defeated the purpose. if you don't take it off properly, you're defeating the purpose. If you take it on and put it off, and you know, if you've had to wear one very much, after virtually, even in a controlled environment, you get warm really pretty quickly. I can't even imagine it outside, but you have to keep in mind what it can do and what it can't do. Unless you have an N95 mask, and nobody, I doubt if anybody in here has ever had one on, because it's very restrictive. You're pulling against the filter. So the effectiveness of the mask, even Dr. Fossey said he had it up to prove, as a symbol, not that it was effective, but to show that he had one on. So you have to take that all into effect. The mask is only moderate protection. It's only moderate protection, just from the fact, if there's any gaps, and you know, the one study that was debunked, they went and had somebody who was COVID positive cough into a Petri dish from 7.8 inches away, and they could not tell a difference in the viral load in the Petri dish. That was rescinded, but you know, I have to ask why, and you'd have to look at the details to know if it was valid or not. But they did pull it back from the Annals of Internal Medicine. So I guess in closing, if the state is on the verge of going from the level 2 to level 3 that doesn't have any masks, why are we being so strict right now in doing that? We know the numbers are going to go up because we're testing more. The hospitalization, the last I heard, for the entire time, Stormont had, the last number that I heard, and it's about a week old, was 33 for the entire time. It might be slightly greater now. 33 out of a couple hundred. I mean, this almost closed down Stormont. I mean, they were running on empty. That's why they were letting people off. So keeping in mind, I'm curious to know what outside data, everything I've read, if you're outside, if you're in a closed area, and we can go to any big box store and see 200 people in the store. Some of them have masks, some of them don't. But you're outside, and the air, well, this is Kansas, it's blowing. It's blowing, but it's still hot. And so we know the heat and the wind are going to blow things away. So to be that strict at this point in time, when we're on the verge of going to level 3, when masks aren't even required, why are we doing it this stringent at this point in time? In closing, what are the numbers for people under 18? It's minimal. The main reason I'm here, I'm as I said, I'm retired. I can go any place and do everything I want. I'm here because I have 4 grandkids that have not gotten to swim yet. They will in the near future, but they have not been in a pool yet. Normally, they're in there every day. It is my hope that we can get to a point where we're treating the citizens of Kansas as adults and not as children, where we have to slap their hands and say, no, you can't do that, on things that I'm still looking, and I have yet to see any studies that can prove any reason that there's a decrease in transmission outdoors with or without a mask. So, do you have any questions?
Questions?
Thank you.
Thank you very much.
Hello, Caleb McElroy. I don't normally like speaking in front of people, but I have a lot of family that sell stuff at the farmer's market, and a question I have is, if this is about health, if this is about the numbers, why do we differentiate between the buyer and the seller? Why can I, as the buyer, walk around the farmer's market with my family, buy drinks, share drinks, high-five people I know, most of us not wearing masks, but my uncle, who wants to hand a piece of corn to me from across the table, why does he legally have to wear a mask or he's going to get shut down? You're going to shut him down if he hands me a piece of corn across the table, but then 10 minutes after it closes and he becomes now the buyer, we can go get margaritas and the whole family can go eat together legally. It doesn't make sense. there's a lot of inconsistencies in the stuff that's being said. And I think people see that, and people are rightfully frustrated. You go to Walmart, and there's 400 people there. 10% of them are wearing masks. And so I get the mentality of you don't want people touching produce and then spreading it that way. But if this is about health and this is about numbers, let's be honest, it's insane. It makes no sense. We're all touching each other. We're all communicating with each other. We're all hanging out more and more. We're all doing stuff. And I don't understand why this is the distinction. If it's about health, why can I, as an American, associate, touch people, but the person selling me corn across the table has to wear a mask? And I think until there's some consistency, people are going to be upset, and that's all I have to say.
Thank you.
Okay, my name is Tammy Hunt, and I'm not here specifically for the farmers market, though that does come into play. One thing that struck me this morning as we were saying the Pledge of Allegiance and ended with liberty and justice for all, I think that's been forgotten. There is no liberty when we're told what to do every second of the day and what we have to wear on our face. I'm a mom. I'm a wife and a mom of 8 kids and 11 grandkids. I'm not a business owner, but I have a stake in what happens in our community. My husband and I have lived in Kansas our entire lives, and for all but 4 years of our lives, we have lived in Topeka. That's well over 60 years. We've chosen that. And quite honestly, I'm angry at the state of affairs. Let me just give you a couple of thoughts here. I have the last couple of years dealt with skin cancer. And so that means I have to do things differently. If I want to be outside, I have to wear a hat, I have to wear sunscreen or long sleeves or whatever that looks like. But I would never, ever go to the farmer's market and say, because I have skin cancer, I expect you to put up an awning so that I can walk all around without being in the sun. That's ridiculous. We can all agree on that. One of my children has celiac, plus a lot of other food allergies. We would never go to a restaurant and say, well, you have to change your menu to suit my child. That would be ridiculous. We can all see that clearly. When in a household as large as ours has been, we had the flu. We've had the flu a number of times. And what I do is I take that child and I put them in their room. They have to stay away from everyone, and I care for them. And we stop the spread because the child who is sick is isolated. Yeah, once in a while, we've had other people in the house have gotten it, and sometimes I've gotten it. That's a risk I take because I'm a parent and I take care of my child who is sick. The point of it is we don't quarantine the healthy people. We don't punish the healthy people. We don't take the liberty of the healthy people. And that's what's going on. If there are people who are out and about, and I'm glad they are, if they're concerned about being out and about and expect other people to wear masks to protect them, they shouldn't be out and about. They should be continuing the online shopping that we had done. In the beginning, you and everybody said we do online shopping, or whatever. I never did. I went to the store. And I've gone to the store probably twice a week for the entire time, at least. No mask, not concerned. When this started and there was people out there with no masks, they were friendly. We had a good time. We were doing things. I'm always cognizant of people wearing masks because that shows they're concerned. And I respect that. But in the last 2 weeks, I've had untold comments of negativity and criticism because I'm not wearing a mask and I'm not taking their safety seriously enough. Their safety is not my problem. I'm concerned about what I do as an American citizen, as a Kansan, as a Shawnee Countyan, as a Topekan. I don't want to infect anyone, but if they are scared to be out, they're the ones that need to stay back. The rest of us should not have to wear masks. We should not be required to wear masks. I also have a child with asthma. It is hard on people with asthma to wear masks. And I'm not sure Dr. Pizzino said anything to anybody and asked if they were having a health issue that could not keep them from wearing masks, because I was understanding that you had that option, that there wasn't. There was an out for those who have a health issue. My son has asthma, and it does cause a bit of anxiety for him to be in a mask while he's working. He's 18 years old. He doesn't want to say anything, but it's ridiculous that we have come to this point. This should not be an issue. We should not be required to wear masks, especially outside. I can't even go there. And part of this is because the fear tactics by the media. There were pictures posted that were not even current pictures of the farmers market, criticizing them for not having their masks on when it was currently not even the time to wear the masks. They didn't have to at that point. But the point remains, if someone is upset about going to the farmer's market and people aren't wearing masks, they should not go. The rest of the public, the 99% of the public who is okay with being out there, should not be punished for a very small amount. And that's what it is, it's punishment. It is not okay. We have flu every year. This is what they've now termed as a more serious type of flu, granted. But it is the flu. It is an influenza-like illness. We have never shut down our country for influenza. Yes, there was a pandemic 100 years ago, but we have never done this. And we should not have done this now, but that's neither here nor there. Right now, we need to look at what is going on now. Children are terrified. There's people wandering around at the lake with little kids on with masks. That is not safe. And they're doing it because they've been influenced to, we've got to do these masks. We don't have to do these masks. And the kids they should not have to. Our schools should be open fully in the fall. If kids get the flu, COVID, whatever you want to call it, okay. We're all going to get it at some point in time if it comes around like the every year flu. And how many get the flu and die from the flu even with the vaccine? It happens. This is nonsense. It's illogical, it's unreasonable, and it does not take into consideration the liberty that we have as citizens, the 99% of us that should be able to live our lives. Absolutely. If someone is concerned, they should wear a mask. Unless it's a huge, thick thing, it's not going to help them, but if it makes them feel better, fine. And I'll keep my distance. I don't have a problem with that. But I just want you to understand, please, this should not be an argument in our community. It should not be an argument with the farmer's market, especially outside. I'm sorry, I'm trying not to be angry at this, but I am angry. I feel like the 99% of the people have not been heard, and that is not okay. So, are there any questions?
Question. Thank you.
Hello, my name's Quint Cook. This is my wife Stacy. We own and operate Stumpy Smoked Cheese. We're a vendor at the farmer's market. We just wanted to stand up today and represent the vendors and say that we do stand behind Mary asking for something special for us because we are outside, we are unique. We also want to represent a company that was doing everything we were asked to do, and we're still possibly going to be punished and asked not to show up because maybe there's one vendor. I would also ask that you would add in another unique situation. Do gather all the names of the vendors. Treat them all as individual businesses, as we are. We're not associated with the rest of them. If we're complying, allow us to do our business.
Yes, I'd also like to add in, we have 4 kids, and so our top priority is to provide for our kids. We did not go to the farmer's market the first couple of weeks just because we were concerned. We stood back, we watched, there wasn't any cases. We very carefully went in and we followed everything they asked us to do. So we're simply just asking, please don't shut us down because of something someone else is choosing to do. Thank you.
Thank you.
Steve Lanterman. I've been retained by the farmers market as counsel. And what I wanted to do was just point out first off, the farmers market is unique in that it is our outdoor market. So coming up with an exception for that, I think it does make some sense since it is that outdoor market. It serves differently than other retail does. And to ignore that fact really is going blindly into this. We need to take into account that you have vendors out in 100-degree heat. Walmart doesn't have that. So we do need to look at a potential exception for that. But the overarching problem has been, at least in terms of the communications, for the farmers market people, it has seemed that the Shawnee County Health Department has been very high-handed in how they've approached this. I understand that sometimes you get busy, you can't send emails all day long, and sometimes they come after hours. Sending an email Friday evening saying you're going to be shut down, that's not good communication. That's not working with people. You are going to give that impression, and we need to do better to work with that. But the idea that somehow the farmers market, and I've heard conflating things here, even about how that's going to be approached, the idea that it's going to be shut down next week, but for the farmers market providing a plan based upon concerns that aren't truly articulated or set forth in a letter that they have not received, that seems awfully difficult to fathom. How is the farmers market supposed to put together a plan not knowing what Shawnee County will A, accept, or B, how they're going to approach that? We get to Friday, provide a plan. If the health department decides we don't like this, we don't approve of your plan, are they supposed to contact everybody late Friday night and say, don't show up, you're shut down for Saturday? That can't possibly be the approach we're trying to take. And while we're willing to work with the health department on that, I think that coming in with that high-handed approach is certainly detrimental, and it's led to what you see here today, which is lots of people here very frustrated because the communication has broke down. And, you know, I will certainly reach out to the health department, try and work with them to come up with a plan. But we need to do better from the top down at making sure that's communicated. We can't operate that way.
Thank you.
Hello. I have just one question.
Could you state your name?
Oh, my name is Erica Grubler. So when I am reading the Phase 3 requirements, there are the retail requirements, which I understand the farmers market has fallen under. We are retailers. We do all pay sales tax. We are individual businesses. Then there are mass events open to public. These include fairs, festivals, carnivals, parades, concerts, etc. Down below it also says events like trade shows. A trade show, I would think, is something where there are many individual vendors. And there are no requirements here that say that trade shows need to wear masks. Am I correct in assuming that?
I don't know. Is that right?
Yes, please.
This is the Phase 3 or Phase 4?
Yes, I just copied just the part on the mass events, which here there are trade shows.
For events like trade shows or displays, that's, those are similar to the Expo Center when they're doing trade shows there. And those vendors would fall under retail, but the mass gathering, again, it's just recommended for the people showing up. They don't have to wear a mask, but the vendors would in that case.
Okay.
They would fall under retail.
That was my question.
My name is Donna McGinty. I am a customer at the farmers market. I don't go every week, but I think it's a valuable resource in our community. One thing that she just mentioned this, and I guess we all have different opinions. 3 commissioners and the three of you disagree on the whole mask issue. So we're not going to solve the mask issue today, but I look out at the vendors of the farmers market. For some of these, this is their livelihood for the year. This is how they make their money. Now, as county commissioners, I would think that you would be concerned with sales tax revenue. My husband is a small businessman. He's an essential employee. He was employed through this whole thing. These people are just now coming back into their venue where they're able to make their living, some of them, for the year. And so I think as a county commission, you need to open up this a little bit, let your opinions on masks, we can hear the science all day long, leave your opinions about masks on the side, think about your duty as county commissioners over the health department of the Shawnee County Health Department. You might want to start thinking about the sales tax revenue that the farmers market brings in. I don't know the numbers, but I can only imagine. We have a pretty big market. It's a great blessing to this community. You have people of all walks of life who have different opinions about the masks. They're willing to be responsible for themselves. I, as a patron of the farmers market, go to the market and am willing to be responsible for myself without wearing a mask. I can't imagine working at the market in 70 to 100 degree weather. I grew up on the farm, working in the garden, detasseling corn. I'm an Iowan by birth, but a Kansan by choice. But I don't know if any of you have ever worked out in the farm or wherever, or outside. I don't know your past. But these are people who are willing to do this for our community, and it's their living that you're talking about.
Thank you. Anyone else like to speak at this time? Okay.
I would.
Oh.
Commissioner Jim Krause, Shawnee County Councilor. I just want to respond to one comment from Mr. Lanterman characterizing the response team's action as high-handed. That's a mischaracterization. I've been receiving emails from them for over a month regarding their communications with the managers of the market. They have been attempting to work with the managers at the market. I understand people are upset, and there's a real debate, a valid debate, over whether masks should be allowed or not, but our staff are following the directions that they've received, period. And they have not been acting heavy-handed. They've been trying to work with the market. We're at this point now. I'm glad we're having a debate about it. I think this is a debate that should be had. But I specifically object to the mischaracterization that they've been heavy-handed. I hope we have a debate and we resolve this issue once and for all, so they're not put in the position of continually receiving complaints from members of the public who have gone to the farmers market, who are complaining to them that the rules aren't being followed. They're stuck right in the middle on this, and I just want to say that publicly on their behalf.
One of the things I came out of all this is they seem to not to have direction on what their plan should be. Dusty, is there any way you can work with these people to help generate this plan so that everybody can?
Yeah, I will just go back and refer to the industry standards. There's templates, there's all kinds of stuff on there, there's guides. To me, it looks fairly easy to do plans, but I do plans all the time, so maybe I'm mischaracterized.
Would you help these people develop
Absolutely,
their plan?
that's my job, yeah.
And so we can
I deal with all kinds of.
assure that we have a market going this weekend.
Mm-hmm.
And, okay. Any other questions or comments?
Just as a side note, Mr. Chairman, 3 weeks ago, the county commission got inundated with emails saying, drop everything, open us completely up. That was about 50 emails. 2 weeks ago, we got inundated over the weekend with about 100+ emails with, stay this course, don't drop everything, follow Dr. Pizzino. Then this week, we get the email. So to say that this is the most emails that we've received, it's been 3 weeks, it's been a month of heavy emails back and forth. And as Jim Crowell said, this is a discussion that needs to be had. It needs to be had in public. There is a division amongst the community as to where we're at. The Shawnee County Board of Health, which is made up by the Shawnee County Commissioners, will be meeting on Thursday. We will be discussing where we're at and if there's changes to where we're at, including masks. And perhaps there's a motion on Thursday that says we drop everything and we open up everything pre-COVID. Maybe there's a motion that says we don't do that. That's what that discussion on Thursday would be. So if you have any desire to address the county commission on where we're at and what we should do, please appear on Thursday after the county commission meeting to make your voice heard.
Thank you very much.
It'll immediately follow the Shawnee County Commission meeting. Typically, you're 9:30 to 9:45.
That's it. Okay, thank you, Dusty. Yeah, if any of you want to leave at this time, that'd probably be fine. We might have to move some other people in, some other, you can stay if you'd like, but I don't want to torture any of you any longer than you have to be here. All right, what's next on the agenda?
Item 3, consent agenda.
I would move that we approve the consent agenda.
Second?
Motion's been made by Commissioner Rippon, seconded by Commissioner Mays. All in favor, say aye. Those opposed, motion carries 3-0. Next item.
Item 4, new business. A, County Clerk, number 1, consider all voucher payments.
We have vouchers that total $738,268.11. The highlights out of that voucher report, under general expense, we have American Pre-Sort of $120,000 for prepaid postage. Under holding accounts with the state of Kansas, $162,758.84. Under health premiums for our employees, $158,303.46. And then under bridge, we have $97,443.37, which is made up of our biennial bridge inventory and appraisal. We have to Cook, Flat, and Strobel for inspections of a culvert over a tributary to Colby Creek, and then Cook, Flat, and Strobel for staking and construction inspection of water line west of Morrill Road. I've had all my questions answered regarding the vouchers and would move for approval.
I'll second. Motion's been made by Commissioner Cook, seconded by Commissioner Rippon. All in favor, say aye. Those opposed, motion carries 3-0. Next item.
There are no correction orders. There won't be any out from now until after we get our abstract done, and it'll be a couple weeks again. So.
Okay, thank you. Next item.
Item B, Health Department, number 1, consider authorization and execution of contract C200-2020 with Lamar Advertising to purchase space on 13 billboards for an 8-week period for the education and awareness of the Kansas Tobacco Quit Line at a total cost of $12,155 with funding from the Chronic Disease Reduction Grant through the Kansas Department of Health and Environment.
Good morning, Commissioners. Craig Barnes, Health Department, here to talk to something about health related that is not COVID. How about that, right?
Good.
Yeah, okay. So, like I said, Craig Barnes, Health Department, as part of our Chronic Disease Risk Reduction Grant, a large majority of the money that we receive from KDHE, the Kansas Department of Health and Environment, is related to tobacco use prevention program. And so, with the COVID response kind of shifting some of our staff duties, we've had a reallocation of some funding that we need to spend down, and so we're going to use those to target increasing usage of the tobacco-free quit line. The tobacco-free quit line is a 100% free resource. It's available 24/7 to our community. You can utilize the resource by calling the 1-800-QUIT-NOW phone line, as well as getting online at the kansasquit.org. The last time that we did a large-scale promotion like this for the quit line, we saw a 180% increase for calls to the quit line during that time frame. So with this funding, we're looking at 13 different billboards across Shawnee County. We are looking at 3 different designs. So we have this design here, this second design, and then we'll also be having a design in Spanish as well to increase availability of the Kansas Tobacco Quit Line. There will be no charge to us for Shawnee County. This is all grant dollars that we're using that have been reallocated to us. And with that, I'll answer any questions that you might have.
I have a question. When they call this 800 number, who are they actually talking to then?
Yeah, that's a great question. So when you call this, the Kansas Department of Health and Environment, who manages the quit line, has a contract. And what they have is they have licensed master level social workers that they talk to that can speak in any number of different languages.
But it's not our department.
It's not our department. No, this is a program that's specifically managed by the Kansas Department of Health and Environment. When you call in, everything is confidential. And you have that conversation with them. They basically set up the first call is retroactive, and then they set up a quit plan for you to move forward to, and then they schedule out calls for you through the period for the number of visits that you work for.
Okay, thank you.
Any other questions?
I'd move to approve.
I'll second. Motion's been made by Commissioner Mays, seconded by Commissioner Rippon. All in favor, say aye. Those opposed, motion carries 3-0. Next item.
Thank you very much, Commissioners.
Item C, Parks and Recreation. Number 1, consider authorization and execution of contract C-201-2020, amendment to contract C-451-2019 with Mid-American Courtworks to extend the current agreement through July 1, 2020 regarding the repairs and resurfacing of 18 pickleball courts in Hughes Park.
Good morning, Commissioners. Randy Luby, Parks and Recreation. We'd just like to extend this contract. As you realize, we signed back in December. They were supposed to be able to get the work done starting in March through May, and we were hoping by June 1st. But like everybody else with COVID, they got behind. So we'd like to extend it 1 month. I was told there should be starting on the courts at the end of this week. So we're hopeful they'll get done here in a couple weeks.
This is just resurfacing and
yes,
and
the
striping?
same thing that we obviously contracted for earlier. So.
Okay.
How often does this need to be done?
Generally, about every 7 years, probably. That's what we find out on the tennis courts and stuff. We're trying to get on that type of schedule.
Do we have kind of a rotation between, the courts at Crossover, or
Yes.
Cressview's got a few of them? And
Yes, Crossover was done, I believe, in 2016. So they'll be coming up here shortly in a couple more years. And we're trying to get all of them on a rotation like that. It's all depending on money and projects. So,
are we seeing a lot of heavy use on the pickleballs?
yes, they're still going really heavy over at Hughes
And
Park.
somebody will contact them and let them know when the
Yes,
construction.
definitely.
Okay. I'll move for approval.
Second.
Motion's been made by Commissioner Rippon, seconded by Commissioner Mays. All in favor, say aye. Those opposed, motion carries 3-0.
Thank you,
Randy.
Commissioner.
Next item.
Item C2, consider authorization and execution of contract C-202-2020 with Century Business Technology to add additional copier services at Central Park Community Center and Lake Shawnee Campground at a quarterly cost of $1,239 with funding from the departmental operating budget and the campground revenue revolving fund.
Good morning, Commissioners. Tim Laurent, Shawnee County Parks and Recreation Department. With some recent changes to staffing locations, we've decided that we needed a couple more copiers. We did talk with Betty Grinder, Administrative Services, that's the idea came up to go on an 18-month lease here. That would then get these copiers, they would expire at the same time as the current Shawnee County agreement, and then we could roll them into the overall overarching agreement at that time. So I'd be happy to answer any questions you might have.
I'll move for approval.
Second.
Motion's been made by Commissioner Rippon, seconded by Commissioner Mays. All in favor, say aye. Those opposed, motion carries 3-0. Next.
Item C3, consider approval of request to award the bid to HTK Architects, Inc. for the services and documentation of the development of the Family Park Master Plan at a cost of $56,000, utilizing the 2019 Capital Outlay Fund, and authorization and execution of contract C203-2020 for same.
Good morning again. Tim Laurent, Shawnee County Parks and Recreation. If you remember back in November of 2019, the commission approved our request to solicit proposals for the development of a master plan for Family Park. Just as sort of a refresher, we had 12 vendors that submitted responses. Back in February, we staff interviewed 5 of those vendors. Professional Services Committee has reviewed our recommendations. We came back before the board on March 2nd and asked permission to enter into discussions with HTK Architects on a contract. We have done that, and we're back today asking that you approve the contract with HTK Architects to move forward with the master plan for Family Park. I do have Zach Sneathen here with me from HTK. If you have any questions for myself or Zach, we'd be happy to answer them.
I have a question for Zach. As part of this process, we would be holding several public meetings to get public input and their ideas. Is that part of this contract?
Yeah, and that's, as we've all talked from the very beginning on this, the public engagement is a important part of this master plan process, and soliciting feedback from the public, getting information out to the public about this project and what could come. We've been, over the last probably month and a half or month or so, we've been talking with amongst the design team, primarily HDK and Landworks, but also with Tim and his staff of what that looks like in the state that we're in now. If you would have asked us a month ago or a month and a half ago, we would have been talking about all online engagement through social media or Facebook Live type events, things like that. Since then, we've kind of transitioned as we've started to see the community start to open back up. We've talked about how can we do still get meaningful input through kind of pop-up events that maybe happen. Maybe there are tents along the side of, say, if we were to do something out at the Midwest Health Aquatics Park, having a tent set up there where people can get information, they can have some interaction with the design team, with Parks and Rec staff, being able to potentially provide input that way. I think as we look at, as we do a lot of this planning processes are really, we try and get, how can we get the most meaningful dialogue with people, and a lot of times those more one-on-one type sort of pop-up events where you're there for a set time and allow people to come through as they're available. You really get sometimes more meaningful feedback that way as opposed to big town hall type meetings. And so I think we're in talking with us on the design side and then with Tim on his staff about how can we structure these events so that we do get meaningful feedback and we do get community involvement through this process. And I think we've got, once we get underway, I think we've got some good examples of what's been done in the past and some good ideas for being able to get that input so that as we do move into, and that process will take several weeks, and so that as we do get into the fall, that we'll be able to have done kind of when people are out during the summertime and seeking some input as we go into more of a developing design concepts in the fall, that we can have we can continue to move the project forward in a manner that's suitable for the project.
Okay, thank you. Any other questions?
I'd move to approve.
I would second that. Motion's been made by Commissioner Mays, seconded by Commissioner Rippon. All in favor, say aye. Those opposed, motion carries 3-0. Thank you, Zach. Thank you, Tim.
Thank you.
Next.
Item D, corrections. Number 1, consider authorization and execution of contract C-204-2020 with Washburn University to participate in the Kansas Career Work-Study Program by employing an eligible employee to work in the Adult Detention Center at $12 an hour with 50% reimbursement returned to the department budget by Washburn University.
Good morning, Commissioners. Brian Cole, Shawnee County Department of Corrections. This is just a continuation of a program that has been very valuable to our department and working in another positive relationship that we've had with Washburn University. Basically, we've entered into a contract to do a work-study program with them and their social work department that allows us to hire a social worker there for $12 an hour through their work-study program, and that we get 50% of that back. Again, this has been extremely valuable to our staff, our inmates, our programs. I've contacted both Betty and Angela regarding this. I think we all felt this was a continued valuable working relationship, and to be able to get valuable services and to provide quality services within the department. We do have the money available for this in our detention budget, and I'd be happy to stand for any questions you may have.
Any questions? I would move for approval.
Second.
Motion's been made by Commissioner Rippon, seconded by Commissioner Cook. All in favor say aye. Those opposed, motion carries 3-0. Thank you, Brian.
Thank you.
Next.
Item E, elections. Number 1, consider approval of request to fill 2 classified positions and to fill any current positions that become vacant due to filling these positions. A, election manager, administration and board workers at a salary including benefits of $63,629. And B, assistant election manager, voter services at a salary including benefits of $56,425.
Good morning, Commissioners. Andrew Howell, Shawnee County Election Commissioner. Just asking to fill these 2 positions. One is the election manager position. Again, that position we've created recently, but it is included in our current budget, so there is no fiscal impact on that position. And the second one has been unfilled for a little while. We had a really good person there, and so we're missing that position, especially with this election that we're going forward trying to complete. So just ask for permission to fill these, and happy to answer any questions if you have any.
Any questions? I'll move for approval.
Second.
Motion's been made by Commissioner Rippon, seconded by Commissioner Mays. All in favor say aye. Those opposed, motion carries 3-0.
Thanks.
Next item.
Would you like to have next item be item F, be the discussion of the Rossville pool?
Yes,
Okay.
that would be fine.
So item F, number 1, discussion on the Rossville pool repairs.
Okay. Tim. Okay, if you could give us a little background on the pool situation and where we're at today.
Sure. Tim Laurent, Shawnee County Parks and Recreation. Dave Aliker was nice enough to put together a little PowerPoint for us today. And I'll try to share some of this. If I can get it to move. So the end of 2019, the city of Rossville reported that the pool was using about 50,000 gallons of water a day. We went through a variety of methods here to try to ensure that the pool had a leak. The water level dropped 9 inches, so there's just a lot of things here. I'm not going to read through them, but we did go through a pretty extensive inspection to try to find the leak, and basically all we could do is confirm that we had one. At that point, we started the process of trying to locate the leak. We came up to the commission. We went out for RFP. We contracted with Carruthers Construction. We managed to locate a copy of the pool prints, but they're very elementary prints. They don't show a lot of detail. We scoped the plumbing, could not find anything that indicated a leak. We tried to pressurize the system, but because of the way the pool was built, I don't understand this necessarily, but it's a closed system, one closed system, so you're unable to pressurize it, which would have helped us immensely. So then we started moving forward, and at that point we had to dig into the deck. You can can see some pictures here. We had to get down to these pipes here so that we could pressurize them individually. At that time, 2 of the 3 lines failed that pressure test. The 2 leaks were, they did some more work and used some sound-sensitive equipment, and they now believe that the 2 leaks are located outside of the pump house, less than 2 feet apart. So the area that we dug up is actually on the other side of the deck, underneath the slide, if you're familiar with the pool. So, I think that's basically what I've talked about here from this point. So essentially, that's where we are. We've spent about $23,000 to this point, getting to this point, I guess. We're being told by the contractor that they believe it could be anywhere from $50,000 to $55,000 to go ahead and fix it. I want to stress that those are preliminary estimates, and really through this whole process, it seems like we've had one setback after another. So I hope that that's accurate, and that's what we end up, facing when we decide to move forward. But there's no guarantee that that's what it'll be. Those are preliminary estimates. And that's really where we are right now as far as the issues with the pool itself.
How much of the decking would they have to tear out to make these repairs, do you know?
I don't know that answer for sure. Would I be fair in saying it's not that big of an area, or it's right over by the pump house? Come on up, Dave.
David Alker, Shawnee County Parks and Rec. We're looking at one section of the deck, probably a 10 by 10 section. That will get us to, we're doing seam by seam is basically, we thought would be the best bet. That way you're not alternating seams, stuff like that, and that will get us down to where we need to get to.
It seems like a lot for tearing out a 10 by 10 section and fixing some PVC pipe, essentially. Do you have any thoughts on that?
It needs to be done.
I know it needs to be done immediately.
I mean, we're just taking that, from the contract.
Yes, that's, well, and there's other things that they, like, be preliminary or proactive in the future. The gate valve that releases all the water after the season's done is 8 feet down, and it's in a hole this big. So we'd like to take the pit that we already have and create a new service area or service pit to where we could potentially drain where the plumbing's already exposed now. We're trying to do proactive stuff according to the future as well. So you're looking about $30,000 to get the current repairs done, and then that extra box or whatever we're going to get to is probably another 5 to 8, and you're looking, we also have to put the plumbing back together on top of that.
It's important to note, I think, I just want to reiterate what Dave's saying is part of the reason we're in the situation we're in is because the way this was constructed, you can't get to these things. And so while we're in here digging it up, I think it's important we go ahead and get it to a state where if we have a leak next year, we don't have to go through this whole process.
Correct, because we can isolate each pipe.
Okay.
Right now we can't.
That's where I was getting to. How long do they think it would take to do all this?
They told me before they had to go to another project, probably about 2.5 weeks.
2.5 weeks. And we are now June 8th. That would put us at the end of the month or 1st of July if we could get on it.
Which in all honesty, I mean, I know the folks in Rossville want to open, and I'd like to do that for them. But as we sit right now, we have a current shortage for guards. And so we're hiring, training. I think that additional time would probably be needed to try to hire and train additional guards to staff that pool.
Do the guards for Rossville, do those primarily come from Rossville?
Yes,
Okay.
Right now I've pulled those guards over to Shawnee North Family Aquatic Center, so it's just right down the highway from them. They had their choice of which pool to go to. That's the one, they carpool, they do whatever, and that's what they chose to.
It's probably closer for them.
If I pull those 7, 8 guards from Shawnee North, we're looking, I won't even have enough for a full shift. That's how short I am.
Is there any possibilities of getting more? Is our shortage because some people are still hibernating from the
A lot of it is because
virus?
a lot of my guards have, since we're not opening until the 22nd, they found other employment, is most of it. They didn't want to wait around. They have college, they have bills to pay just like the rest of us. And they decided to vacate this year, and maybe next year when everything's back to normal, they will come back. I don't know yet.
Now, the rest of our pools are opening on the, what time, what date?
June 22nd.
June 22nd. Okay, so that wouldn't put this one too much further behind the others.
Correct.
If we were to get going. Okay. Yes.
Just for information, the contractor that built this pool, have they done any of our other pools?
Thank goodness, no.
Okay, thank you.
This isn't the contractor that built the pool?
No.
Okay, good, good. That's-
No. We reached out to them to try to get a as-built
Yeah.
from them.
Couldn't get it.
Couldn't get it.
That's pretty bad. Yes.
One other question. Also with the restrictions in place, that we're going to be operating the pools at half capacity, basically, isn't that, is that?
If we go pro quo, the way we're phasing out the 22nd, so we would not have those restrictions.
Okay.
Possibly.
Possibly,
But
if everything stays according to statute.
Well, let's just hypothetically say that if we are only allowed to operate at 50% capacity, does that change the number of lifeguards needed?
No.
Okay.
You still got to guard the entire pool, so it really would have no impact.
It actually burdens us more because then we have to keep people separated in a pool, and that's almost impossible. To where they can't interact per groups, according to.
Betty, as far as money available for this project,
Betty
we-
Griner, Director of Administrative Services. You had asked me this morning where we were on our contingency funds. For the 2020 contingency funds, as you know, we budgeted $1 million for that. To date, we have committed $75,857 of that. So we have remaining $924,000 of our contingency for 2020.
okay, so we're in good shape there.
Mr. Chairman?
Yes.
Just as a point of order, again, I would raise, if I could just maybe ask Tim some questions.
Yeah.
We knew about the leak in July of 2019, correct?
Correct.
And you came to the county commission identifying that there was a leak with the pool, correct?
Yes.
And then you asked for us to be able to go out and camera scope it first to see if we could identify the leak, correct?
Yes.
And the county commission approved that expenditure.
Correct.
And then we came back and we determined that we were not able to locate that leak as easily as we thought.
Right.
And then we went out for a second bid for the repair with Carruthers.
Yes.
Through this process, have we had an ongoing discussion with the city of Rossville about whether or not this is maintenance or if this is a construction repair?
We have been discussing, first I want to just note that we have included the city council in Rossville in all of these discussions, and they've actually, members of the city council have met with us on site when we're there. So we've tried to keep them informed as much as we possibly could. There have been some discussions. Myself and Randy Luby met with the city council, and we did discuss the contract briefly and whether this fell as just routine maintenance or whether this was something different. And, I don't want to speak for the Rossville City Council, but I think we both left there and during other conversations with the impression that they really didn't have the funds to move forward with the repairs themselves.
Okay. Now, the Rossville pool is owned by the city of Rossville.
I believe that's true.
Now, this is subject to a series of contracts, and I asked the clerk to prepare those for me, and I was hoping to have opportunity to review them fully before, having a vote on this. But if I go back the original contract is from May of 2007, and under that contract, it says the city agrees to repair any maintenance or equipment problems that occur with the Rossville Community Pool. So the original contract was that the city was going to be responsible. Then that was amended in September of 2007, and at that time, it designated that the county would be responsible for, let me see, we were responsible for the hiring and staffing, the revenues, rules and regulations, the use of the facility, the dates of operation, investigation, defenses, and claims, and then it added, the county agrees to repair any maintenance or equipment problems occurring with the operation of the Rossville Community Pool. So we had a shift from the city to the county. Again, the words are maintenance or equipment problems. That was then later amended in December of 2008, whereas the city deeded the property, excluding the pool, to the county for $1. And at that time, the county took out bonds specifically for the installation of the slide, where the county took out the bond totaling $428,403 for the construction of the slide, and this was then occurring in 2009. And under that, the county oversaw the operation of the installation of the slide, but the pool still being owned by the city of Rossville. Throughout the history, the city and the county have been sharing expenses with the maintenance of the pool, including painting, and so in 2009...
Were they sharing or just shifting?
Sharing. Specifically, in August of 2009, when it came to compliance with the Virginia Graham Baker Pool and Spa Act, and they were cost sharing. So the city of Rossville and the county have had a history of cost sharing, which again, Mr. Chairman, is why I think that we've known about this item, and for 8 months we have been putting out to the public, and repeatedly I have as a commissioner been saying, we may not have the pool of Rossville open this summer. And this is not news, this is not surprising. It may be surprising to the people in the city of Rossville, but this hasn't been something new. And I believe that when we have government, we are to be transparent in what we're doing. We have an estimate of in excess of $50,000 with no notice to the public of our expenditure or intent to spend $50,000. There remains a question about what responsibility is with the county, what responsibility is with the city of Rossville, and for that reason, I would ask that this board defer taking any action at least until Thursday for legal counsel to review the contracts, for the notice to the public, especially when we're talking about in excess of $50,000, drawing it from contingency funds, and whether or not this is an emergency that would be a contingency or under a regular expense for the Parks and Rec Department. The only emergency is it falls in the county and the pool wants to be open. That's the emergency. It is not open when all the rest of the pools are open and the city of Rossville is impacted. But that's what we've been working towards, is fixing this problem. This is not an easy fix, and when David Alaker came to the county commission back last fall, he talked to us about, we hope this is an easy fix. When he came to us in early 2020, he said, it's not looking like it's going to be as easy a fix, but I hope it's going to be. And so this is something we've now received presentation, David, 3 times on. And so I fail to see that this is an emergency expenditure where we would waive notice to the public, where we would use contingency funds without investigating it a little bit further.
I can wait till Thursday, but I don't want to go beyond that because we do need to get this thing resolved and get a pool going. Kids in a small town like that, that's, there's not a lot of choices like you have in Topeka. There's all kinds of pools here. But in that town, that's it. I can wait till Thursday, so our legal, so Jim can review the contracts, and
So motion to defer any action until Thursday.
yes.
Can I ask just one question real quick? So you said you've had discussions with the Rossville City Council. I mean, and I know that they have a differing opinion on whose responsibility the repairs are. If there is in fact an opportunity for cost sharing, have we made that ask? Have we said, let's go 50-50 on this? And we'd be happy to pay this, and then it's on you to finish it up, or, I mean.
Sure. We didn't ask specifically to do 50-50 or do a cost sharing. We did sit down with the council and ask if there was any way they could help. If they had any funds to assist us. And so, in my mind, that was cost sharing. We didn't talk about a 50-50 breakdown. At that time, their answer was no. They didn't feel like they had any funds to do that.
Mr. Chairman, if I could, just maybe ask Betty Griner a question. The city of Rossville receives a portion of the half-cent sales tax that does not come into the county, and they retain their portion of the half-cent sales tax.
That is correct, yes.
So-
All of the cities receive sales tax from the countywide half-cent sales tax. Only the city and the county combine our money to JADO.
So the city of Auburn, the city of Willard, the city of Rossville, the city of Silver Lake, they retain their portion of the half-cent sales tax.
They do. I do not know what amount that is that they do receive.
Okay, that might be an item, again, to know, because our money from the half-cent sales tax goes into things like pools, the zoo, bridges, roads, the Stormont Vale Event Center. And so I think that to say the city of Rossville has no money, it may be an unbudgeted item, but as opposed to, we could have an agreement for cost sharing. So.
All right. Well, I don't want to go beyond Thursday on this, so.
I'm fine with that.
Motion to defer action until Thursday. Is there a second?
There was a motion.
Yeah, I'd second that.
Okay.
Motion's been made by Commissioner Cook, seconded by Commissioner Mays. All in favor? Opposed? All right, motion carries 3-0. Thursday, we'll hammer that one out. Next item.
Item 5, administrative communications.
Do we have anybody that needs to speak at this time? Seeing none. Commissioner Cook, do you have any
No. comments?
Commissioner Mays?
No, I'm fine.
And I don't have any comments. I would like to make a motion to go into executive session for a period not to exceed 30 minutes for the following reasons. One, to discuss personnel matters of non-elected personnel, specifically to conduct interview for an open classified position. This will be 30 minutes. The interview is scheduled for 11:30. Following this meeting, no action is expected at this time. So, we are adjourned till 11. That's a motion.
Second.
Yeah, a second?
Can I ask one question before?
Sure.
Jim, I know we've been doing these executive sessions. What's the protocol for discussion of the collective? Do we need to can we do it in the same executive session today? Or do we need to do that on Thursday, or?
If I understand your question, what you're saying is you've been conducting a series of interviews.
Right.
and
When do the
When do
three of
you
us
discuss the results of those interviews?
Good question.
I think you've just made a motion to just do the interview. I think if you want to do additional discussion, you probably need to add time and identify that along with it. And you can either do that today at the end of this one, or you could do it Thursday.
Let's take it up on Thursday.
Thursday's fine.
Okay.
I'm good with that. Okay.
But on your motion for executive session, Commissioner Mays, have you seconded?
I've seconded.
He seconded.
I didn't officially, but I will now.
Okay. Motion's been made by Commissioner Rippon, seconded by Commissioner Mays. All in favor, say aye. Those opposed, motion carries 3-0. So we will go into executive session 11:30, and we'll be back here at 12.
They're all in the chair today.
home?
Hey, we're back.
We went a little long, didn't we?
A little bit, yeah.
Hold on. Oh, I gotta get the main one.
Ready? We are back in session. No action was taken at this time, so we're now adjourned. Thank you.
Thank you.
See you Thursday.
Any word on the new desk?
They said about a week.